Welcome to Channel 17, the Town of Colonie Government Channel.
Hi, welcome to the Senior Resources Show. My name is Christine Cary, Director of the Town of Colonie Senior Resources Department. Thank you for joining me today. My guest today is Candy Rivera Whitehead. She's an outreach representative with the New York State EPIC program, and she was a guest of this show last year. Candy, thank you for joining me today.
Thank you, Chris, for the invitation.
Oh, it's always great to have you here, and I know many of the seniors in the town know you because you're a friend to all the seniors. You've been out to the senior clubs, and you've been in our office helping people with EPIC for how many years?
A long time now. Probably it's 24 years now.
Wow. Yeah, EPIC's been around a long time, and I'm surprised. I was just telling you a little while ago about a lady who told me recently, who was in the donut hole with her prescription drugs. She had no idea about EPIC, so that's why I asked you to join me today, so we could kind of give a little refresher and talk about the changes to the EPIC program this year.
Definitely, great.
Well, let's just start. How long has the EPIC program been around? Is it the full 24 years? Or
Yeah, well, as I mentioned, it's going into its 24th year. It actually was the first day of enrollment was actually October 1st of 1987, believe it or not. So it's been around for quite a while. We currently have about 300,000 seniors enrolled in the program, still room for many, many more. So that's why it's so important for programs like this. As you mentioned, people that still, for whatever reason, may not be aware that EPIC even exists, that it may be an option for them. And of course, this is an important time of the year because a lot of these seniors are actually taking this particular time and thinking about, what am I going to do for 2011 about my medical, about my prescription drug plans. So along with that, it's a great time of the year to start thinking about EPIC and whether or not they're eligible for it.
Well, for many years, EPIC was the only game in town, correct? Unless you had a little bit of coverage under your Medigap plan. You had no coverage before the Medicare Advantage plans came around. EPIC was the only option for folks for many years.
Exactly, and that was really, you think about it, right now there's Medicare Part D, but that wasn't even created until 2006. Prior to 2006, people who were on Medicare really didn't have an option as far as drug coverage, and that's the whole reason why EPIC was created. The state of New York saw a need that their residents in this area, in this New York state obviously, have no prescription drug coverage under Medicare, so they created the state program EPIC back in 1987, and since then it's been really a godsend to a lot of people enrolled in that are actually enrolled in it. Obviously now, as of 2006, people also have the option of the Medicare Part D, and the two actually work very well together.
Well, we'll get into the Medicare Part D because that's the part that I'm always trying to learn more about. But let's start with the EPIC program, just kind of do a 101. You know, what is the eligibility? How hard is it for a senior to apply? Just some of the basics of EPIC, if you could.
Not a problem. First of all, as you mentioned, there is an eligibility to the EPIC program. Seniors do have to be 65 years old or older. They have to be a resident of New York State, and they also have to be income eligible. Being a state program, the income eligibility for this program is for a single person, and that includes single, widowed, or married living separately. We do consider them as a single person. The annual income cannot exceed $35,000 a year. If they're married living together, they have to combine their income, and their combined annual income cannot exceed $50,000 a year.
And that includes Social Security?
That does include Social Security, the net Social Security. Okay. One thing a lot of people really don't understand, because they automatically think, oh, if I got to claim my income, it's everything. This state program actually just looks at income. It doesn't look at assets or resources, how much money you have in the bank. That makes a huge difference, because it's basically your total adjusted gross income plus your net Social Security. And by net, I mean the actual, the amount of your Social Security check after the Part B premium has been taken out.
Which is about $115 a month.
Exactly. That's what we would add to the total adjusted gross income, and for the most part, that would be their EPIC income. But we do not look at assets or resources. Another thing that's important for them to understand is that it's always based on previous income year of the year that they're actually going to enroll in the EPIC program. So, example, someone who's enrolling now, maybe in the month of December 2010, they would look back at what their income was in 2009, and that's what they would use.
So if they were applying now for 2011, you would still be looking at the 2009 income if they're applying in December.
Exactly, because it's based on when they complete that application.
Now in New York, we have a lot of snowbirds that take off to Florida or warmer climates for the winter. How does EPIC, how does that residency affect EPIC eligibility?
That's a very good question, because we do have a lot of what they call snowbirds going away for the winter months. Lucky them.
Yes,
but
really.
The fact is that as long as New York State is still their residency state, and they may go away for a temporary period of time, maybe 4 months out of the winter, but New York State is their residency state, they would still be able to apply for the EPIC program. Now, the fact that they're enrolled in the EPIC program, it doesn't mean that, for example, if they go to a Florida pharmacy, they're going to be able to show their EPIC ID card and purchase their prescriptions in Florida. However, they would be able to call their New York State pharmacy, renew their prescriptions, and then have them mailed to either by the pharmacist or a friend or a relative to where they are on a temporary basis. But they still would be able to take advantage of the EPIC program.
Well, that's important that people know they can't use their EPIC card down in a Florida pharmacy or wherever they might be. Good information. What types of plans are available through EPIC? I know you talked about the income eligibility for the EPIC program, but what are the types of programs offered?
Right. Well, once they're eligible in the EPIC program, or once they actually enroll in the EPIC program, it's actually their income and their marital status that is going to determine which one of the two plans they're going to be eligible for. As you mentioned, there's two plans. One is called the fee plan. One is called the deductible plan. They don't pick the plan that they want. It's picked based on their income and their marital status. So, for example, the fee plan is available for single people with income under $20,000 a year, and married people living together, income under $26,000 a year. The fee plan is just as it implies. There's actually a quarterly fee that they would pay based on their income and their marital status. They pay their quarterly fee, they get an EPIC ID card, they go to the pharmacy, and based on the cost of the prescriptions, they will pay co-payments on their prescriptions of $3, $7, $15, or $20, depending on the cost of the prescription. So again, with the fee plan, they pay a quarterly fee, but every single time they go to the pharmacy, they're going to pay a co-payment on that prescription. Unlike the deductible plan, which is for higher income people, if they're single and their income is more than $20,000 but less than $35,000, or married with income more than $26,000 but less than $50,000, they're going to be in the deductible plan. The deductible plan is actually a free program. There's no fee for them. They enroll in the program, but they will have to pay out of pocket the full cost of their prescriptions up until they've met their specific deductible amount that, again, is based on their income and their marital status. But once they have paid out of pocket and met that deductible, then that's when they start saving on EPIC by paying the co-payments of $3, $7, $15, or $20. So really, it depends on their income and their marital status, which one of the two plans. And I really like to explain the two plans very specifically, because a lot of seniors, for whatever reason, once they get into the program, you'll ask them, well, what plan are you in? Well, I don't know. So again, if they're in the fee plan, they're more likely going to pay a premium to EPIC on a quarterly basis. With a deductible plan, they have to meet a deductible first.
And because the fees are relatively low, I know many of the folks I help just send it in once a year, and then they don't have to be bothered with paying it quarterly. So that's a nice thing that folks can do as well.
Exactly,
Nice.
yes.
Now, you told me this years ago, and it never really clicked for me, but makes a lot of sense. The deductible plan is a free plan until, as you pay your prescriptions and work towards the deductible. And many people don't enroll if they don't have prescription drug coverage, but if they don't have any prescription drug drug needs, excuse me.
Right.
But you never know if your situation's going to change, and it's always a good idea to apply if that's the income guidelines that you fall in. Is that true?
Oh, exactly, and that's the whole purpose. And when I'm out there talking to the senior population, and I do run across people who say, well, you know what, I'm really not taking any meds right now, or I'm taking a very small amount of medication, and I get them for $4 at, my local food store. The fact of the matter is that may be well and true, but it's important for them to enroll in the EPIC, to have it there as a safety net for them. Because like as you indicated, we're sitting here fine today, no worry in the world, but then all of a sudden you don't know what's going to happen tomorrow. And God forbid they could end up in a hospital and then end up with a handload of prescriptions that they never had before. At least they already have their EPIC in place, that they have whatever little bit they did purchase, it was accumulating towards their deductible. So I always encourage them, even if you don't think you're going to get the benefit of it now, as long as you're eligible for it, get into it.
And it's no work. The pharmacist is the one who does all the work, putting it through to EPIC, correct?
As far as billing, yes. In other words, when they go to the pharmacy,
on the senior's part.
Exactly. They don't have to save receipts and then send it in. When they purchase their prescription at the pharmacy, the pharmacist will transmit that to EPIC via the computer. If they're in the fee plan, they'll pay a copayment. If they're in the deductible, the pharmacist will collect the full price of the cost of the prescription, but then that information is sent to EPIC. We keep track of how much they're spending. So at the moment that they meet their EPIC deductible, they automatically start paying our co-payments.
That's great. That's great. Well, now we'll get into where it starts to get a little dicey, even for myself, who works with Medicare prescription drug plans all the time. As many of our viewers know, the Medicare D is a federal program under Medicare where seniors are eligible for drug coverage through this program. Now, EPIC is out there too and has been so many seniors' friends and New York's friend for so many years in New York State. How does the Medicare D plans impact EPIC? How do they work together?
That's a very good question, because a lot of people still out there, that especially some of them that maybe don't know that EPIC exists, or they've heard about it, don't realize that they can actually have both plans together. Now, of course, if they have a Medicare Part D drug plan and they're eligible for the EPIC program, the system is set up so that Medicare will pay first. EPIC is actually going to supplement their Medicare Part D. And by supplement, I mean that everything that's coming out of their pocket under Medicare Part D, whether it's cost of prescriptions that may actually go towards their Part D deductible, or whether it's a co-payment, or whether they're in that infamous donut hole where they're paying, well, this year they're paying the full cost of the prescriptions while they're in that donut hole. Everything that comes out of their pocket will actually also be submitted to the EPIC program. So how that works is, let's say under a Medicare Part D, they go to a pharmacy and the co-payment under the Part D is a $35 co-payment. Well, before they pay that $35, the $35 will go towards their EPIC program, and if they're in our fee plan, which means that they pay a co-payment, the $35, they will now pay our co-payment, which is $7 on a $35 prescription. So you can see that the benefit for a person would be that they're going to pay lower co-payments. And again, if they're in the donut hole, which this year, once they go into a donut hole, and many people do end up in that donut hole with Part D, and they're responsible for paying 100%, well, the 100% will go to EPIC. And if they're in our fee plan, they're going to pay our co-payments. So it totally will help them, especially during that donut hole.
It really wraps around.
Exactly. They're going to be paying our co-payments during that donut hole. If they happen to be in the deductible plan, which we just spoke about, and they have to keep in mind that they have to meet our deductible first. Again, everything that's coming out of their pocket, whether it's a Part D deductible, a co-payment, whatever they actually would be paying under a Part D, would go towards their EPIC deductible. So all of that is bucketing towards their EPIC deductible. At the moment that they meet their EPIC deductible, that's when we kick in and they'll start paying our co-payments. So it really, whether they're in our fee plan or on a deductible plan, there's really no reason for them not to have Medicare Part D and Epic together because it's just a wonderful safety net for them. Not to mention the fact that the Epic program will actually assist in paying their Medicare Part D program, or their premium under Medicare Part D. Now, this is important, and this is one of the reasons why I said it's important for them to know whether they're in the Epic fee plan or they're in our deductible plan, because depending on which one of those plans they're enrolled in Epic, the fee plan people, we, the state of New York, will actually pay their Medicare Part D drug plan up to $38 and change in 2011, okay? So that means that they don't pay a Part D plan, they're going to pay the Epic
As long
premium.
as they're in the fee plan. It doesn't matter what their income is, as long as they're in the fee plan.
Exactly. The regional average is about $38.69 for 2011. So again, if they're in the Epic fee plan, the state of New York will pay their Part D premium up to the $38.69. Okay? If they happen to be in our deductible plan, which, remember, they don't pay a premium to Epic, if they have a Medicare Part D, they will pay the Part D premium. But what the state of New York will do is that the money that they're paying, the average cost of $38.69, you multiply that out, and for an annual premium under Part D is $464. They'll take the total of the $464 and apply it to their Epic deductible, which what that means, if they have, let's say they have a $900 deductible with Epic, and they're paying their Part D premium, we will take the $464 and apply it towards their $900, so they actually have a deductible of under $500 to meet with Epic.
I may have known that at one time, but I forgot that. So I've certainly learned something new today. That will certainly help me as I counsel people on Medicare D. Now, if a situation came up where an individual was looking at their options under a Medicare D plan and wanted to keep their premiums low for their Medicare D plan, and they were in the deductible plan, will you cover the deductible while they're in the deductible?
They have a Medicare Part D plan.
They have a Medicare Part D plan. They're in the Epic deductible plan.
Right.
Excuse me. And will Epic pay the $310 deductible that they have on their Medicare D plan? How will that work? Or is that the same as?
Right. As far as paying it, let's change the wording around. What happens again? What the Epic supplements their Medicare Part D. So let's say they have a deductible under their Part D.
Right, exactly.
Okay, they also have a deductible that's been lowered because they have a Part D.
Right.
When they go to the pharmacy, let's say they go to purchase a $100 prescription, it will go to their Part D deductible first.
Okay.
But then the same $100 will also be applied towards their Epic deductible.
Okay,
So it's
good.
being applied to both deductibles.
Wow, that's great.
Which is a huge benefit because, like I said, they're paying Part D, everything that is coming out of their pocket, whether it's money that goes towards the Part D deductible, and of course, once they meet that deductible, they're paying Part D co-payments. All of that will go towards their Epic, whether it's the fee plan or the deductible plan. It will all go towards their Epic.
Wow, that's really important information and good for folks to know. Something we've talked a little bit about is Epic requiring folks to join a Medicare D plan now? Is that something that I've heard recently?
Exactly. Most people, since about 2007, most of the Epic members do have a Medicare Part D, and we do require people who want to enroll in the Epic program to have a Medicare Part D drug plan. However, we still have some exceptions. By the exceptions, I mean if people qualify for these exceptions, they would be able to have Epic by itself. If they qualify for the exceptions, which I'll indicate what they are, and they are eligible to have Epic by itself, this is important for them to understand, is that Epic would be considered credible coverage for them. So that if we allow them to have Epic, we're credible coverage, and not require them to have a Part D will actually protect them against the penalty for not taking the Part D. a few of the exceptions would be, the first and foremost would be if, for example, they're not eligible to have Medicare because they don't have A and or B, they're just simply not eligible for Medicare, but they're 65, a resident of New York State, and they meet the income eligibilities, they would be able to have EPIC. They're obviously not going to be able to have a Part D because they don't have A and or B. The other exception is that if they have a union or retirement plan that says to them, don't sign up for a Part D, and it's in few cases they might be eligible to have the EPIC program, we would not make them take a Part D. Okay? The other one, and which affects a lot of people in our area, are people who are enrolled in a Medicare Advantage plan, and that is an HMO or a PPO. If many of our members that have an HMO or a PPO, they're not required to have a Part D. They would be able still to have EPIC and not have the penalty for not taking a Part D. So that means that if they had an HMO or a PPO and we did not require them to have the Part D, they would be able to pick up the medical only and pick up EPIC for their prescriptions.
Oh,
okay?
That's interesting.
Now, the thing is, though, that every year the state of New York evaluates the plans, and there are some plans within our area that, by Medicare Advantage plans, HMO or PPO, where we would enroll them in that Part D. Okay? Some plans, Medicare Advantage plans, HMOs and PPOs, they would be able just to have EPIC. So what we would, in other words, it's an exception, but there's still a situation where they may be asked to join the Part D. If they're not sure about whether or not they need to have the Part D, it's something that they can always contact EPIC or actually speak to the Medicare Advantage plan that they're trying to enroll in and saying, I also have EPIC, do I have to take your Part D?
But I find for most folks it's advantageous for them to have the Medicare Part D and the EPIC.
Exactly.
It just works together. It reduces their co-pays at the pharmacy.
Exactly.
So that just makes sense.
Yeah, pretty much when I'm out there doing my presentations and talking to people, I always, especially with the Medicare Advantage plans that are out there, I always talk about the benefits, even if they are in a Medicare Advantage plan, picking up the Part D, having their EPIC, because again, then we revert back to the fact that if they have a Part D and they're enrolled in the EPIC program, remember, we were going to pay the Part D premium up to about $38 and change, or apply it to their deductible. So, you can see that there's a huge benefit, even if they're enrolling in a Medicare Advantage plan, which they would pay a higher premium because they had drug coverage. In some cases, we're going to assist them with that monthly premium. So it just makes sense to have the Medicare Part D together with their EPIC.
You're absolutely right. And before we go any further, I want to remind our viewers that the Town of Colonie Senior Resources Department, we're New York State health insurance counselors. We're certified through the state to provide health insurance counseling. What we do is we sit and talk to folks about what their options are, because as folks are watching the show today, there's a lot to it. It's complicated. There's a lot of information out there. I hear from seniors every day that they're getting inundated with mailings from health insurance companies, and they don't know what's the right option for them. So utilize the resources that are available in the town, and I'll make that information available at the end of the show. But as we're talking, I'm thinking, gee, this could be a little overwhelming for folks who, especially when they first turn 65 and they're really starting to have to make choices that they've never had to do before. So it's good for folks to know that they can also pick up the phone and call the EPIC program. The folks on the customer service line are just great in working with folks through their questions and their problems.
Yeah, and that's the most important thing, that as long as they realize that there are options out there, one of them being a state plan supplementing their Medicare Part D, and like you said, it is confusing to them. There is a lot to think about. They may not know, well, geez, I think I'm eligible for it, but I'm not sure. Gee, should I have EPIC together with my Part D? You have the EPIC helpline, which we're available Monday through Friday. It's a toll-free number, 1-800-332-3742. they can, and if they have any questions whatsoever, they can call and speak to real life people
That's
that they're
always
going to be
nice.
able to ask questions about whether or not they're eligible for EPIC. And again, can you tell me if this is going to benefit me? I'm enrolled in a Medicare Advantage plan. I'm not sure whether I need to pick up their Part D or not. We're going to help them with those types of questions. Again, along with the town of Colonie, like you indicated, the resource center there is also fully aware of EPIC and how to speak to them and who's eligible for it and how it works.
I think unbiased information is very important for folks to get to know that they can pick up the phone and get information that is very clear and concise and is unbiased. Will help them to make what is the right choice for them. But we talked a little bit about some of the changes to EPIC. Are there more changes that you'd like to talk about?
Yes, there have been some changes that became effective as of October 1st of 2010. And the changes are actually involving the people that have EPIC together with their Medicare Part D. Now, as I mentioned to you, EPIC will supplement their Medicare Part D, which means that everything that comes out of the senior's pocket when they submit it to the Part D, whether it's co-payments, deductibles, or they're in that coverage gap, will also go towards their EPIC program. The change that came about is that in 2010 and prior, if, for example, a drug was denied by the Medicare Part D because it was a non-formulary drug, which seniors, should be very familiar with formularies, because when you're dealing with a Part D, that's half the battle of trying to pick which Part D you're going to sign up for, is which one's going to cover the medications that I'm on. So if, for example, an EPIC member that has a Medicare Part D runs into a situation where the Part D plan is not going to cover the medication that they need, okay? Whether it's a name brand or it's a drug that happens not to be on their drug formulary. Before EPIC would automatically cover it, as we did in the past, what's going to happen now as of October 1st is that the pharmacist then would have to contact the doctor and ask them if there is another drug that's available under their Part D drug formulary that this patient could take. If the doctor says, no, absolutely not, this is the medication that my patient needs, then the doctor at that point contacts EPIC and indicates that they are going to appeal it with the Medicare Part D plan. At that moment, the senior would be able to pick up a 90-day supply of that prescription that they need to give the doctor time to go through the appeals process. Now, the good part about this is that if the doctor goes through 3 levels of appeals and gets denied at every level, so ultimately what's happening is that the Part D plan says we're not going to pay for this drug, EPIC will pay for that drug. As long as the doctor has made the attempt to try to get it covered by the Part D and has failed because they will not cover it, EPIC will cover that drug. So there's another good reason to have EPIC to be used as a safety net, because you never know. You may pick a plan at this time of the year for next year and say, the plan that I picked is paying all my medications. But then sometime in like April or May, the doctor puts you on a new medication that is not on their drug formulary. You have to stay in that drug plan for the remainder of the year. It's nice to know that because you have EPIC, you may be able to have that covered with the EPIC program. Yes, they do.
Formularies change during the year.
The formularies change, your situation changes as to, like I said, maybe you didn't start off with that medication at the beginning of the year. So again, there's another good reason why EPIC is a good supplement to have with their Part D, because we would help them throughout, to pick up the prescription that they need if the formulary is an issue.
Okay, well, we're just about out of time. Were there any other changes that you wanted to address, or was that the major one?
That was pretty much it for this year.
All right, that was enough. I'm sure the doctors' heads are spinning. But it's still a great, that they can get the 90-day supply, and that, the appeal process. I've had seniors go through it, and it hasn't been too cumbersome for the doctor to do it for them. So, and many
No.
times they'll just be able to switch the drugs.
Exactly,
So-
and that's the whole thing. And the benefit for that is that the more the senior works with the drug formulary under Part D, then the more times Medicare Part D pays and then Epic pays, the more the senior is going to save
More
because
going to save,
they're going to pay
absolutely.
lower co-payments. So there's a huge benefit for this change as far as the senior saving more money.
Absolutely.
Yeah.
Well, this has been great information. It's been a good update for our seniors in the community and for their caregivers who are helping them to make
Right.
choices around insurance. I thank you very much for joining me, Candy. We
Thank you,
will
Chris.
post at the end of the show the contact information. I know that you're always available to go out and speak to senior groups, so they'll have your information if they want to call you or to set something up, or you can contact myself at the Senior Resources Department, and I can put folks in touch with you as well.
Great.
So thank you so much for joining me today, and thank you for
Chris.
joining me today on another episode of the Senior Resources Show. Thank you. Have a great day.